BFA acupuncture. That's called as a Battlefield Acupuncture is the most renowned acupuncture people are practicing across the globe. Dr. Richard, who is the Air Force colonel, and also he is the oncologist. He invented some of the points to treat for the defense people at the time of the Iran and Afghanistan war. So he found it that yes, most of the people are really miserable, that they are affecting for the pain related conditions, how I need to help. In that way he founded some of the only the 5 points which will be more useful to treat for the auricular related points to treatable for head to toe, and those points we're going to see today. The first point is treatable in 2001. In 2001, and he introduced these points around 24 years ago. That's called as a battlefield acupuncture. Those points we need to understand now so that we can use it for the emergency pain conditions, head to toe, anywhere we have the pain. So that time we just use this by using the auricular. 5 points will be treatable by activating. So now you just try to see step by step, randomly don't apply. I know the 5 points you are applying abruptly somewhere is not good, but I will show you systematically from step by step. Accordingly you just apply. Now the first point to be known as a cingulate gyrus point. The first battlefield acupuncture is introduced the point to be known as a cingulate gyrus. So cingulate gyrus is the part of the brain in our brain that's called as a, especially the corpus callosum. That means is the right hemisphere and left hemisphere that combining together, the meeting together, that to be known as a corpus callosum. Now the cingulate gyrus, cingulate is to be known as a, there is a in the Latin word that to be known as a belt. Daimai meridian. Daimai is the belt meridian. Likewise, is the cingulate means is the belt. So that belt level, that superior to the corpus callosum of the brain, so that entirely that covering of the brain to be known as a cingulate gyrus. So that cingulate gyrus is taking care for all our emotions, and also there is the emotional kind of the pain. But the people having the different kinds of the pain, but one among them is the brain itself is causing the problem because our thought process. Now that we are really miserable, pain is too much pain, but one of your close friends comes and talking to you, the pain you have forgotten, that indicating that's not real pain, that is the emotional pain you got it. To get rid of that pain, we just use the point to be known as a cingulate gyrus. Cingulate gyrus, we just apply the point which is called as a intertragic notch. So this point to be known as a cingulate gyrus to treat for the emotional related problem. The second point to be known as a thalamus. Now we can recognize the point to be known as a thalamus. Where is the thalamus point is located? As I told you, there is a temporal lobe inside the brain system, where there is a forebrain. After the forebrain is the parietal temporal bone. So temporal region, the thalamus point is located. Thalamus, you know, there is a relay station. One is the thalamus, the second to be known as a hypothalamus. Both are really important for the relay station. What is the relay station? Now there is a pain somewhere in the body. The pain is taking care to the thalamus from the spinothalamic tract. It goes to the thalamus. From the thalamus it goes to the third level of the brain, right? So that time we recognize the thalamus point is the sensory function, and also there is a motor function. That means it taking the energy, peripheral nervous system it takes to the thalamus, then the efferent nervous system from the brain getting the signals to the periphery nervous system. Now I have the pain signal goes to the brain through the thalamus, then the pain get relief, then the brain it gives a signal to the thalamus, from the thalamus it gives to the periphery. Now I got the relief. That is indicating is the thalamus. So therefore we just activated the point, second point to be known as a thalamus. How to recognize this 2 point? Remember, CT scan is, C is related to the cingulate gyrus, the T is indicating for the thalamus, CT. There are the 2 points got completed. The third point to be known as the omega 2 point. So the point is located in this region. How to locate this point? So you just look at about the secret. This is the apex of the ear. The apex of the ear. So next to that, just distal to that region, apex of the ear, distal to that region, just distal to that region, approximately 2 mm, just distal to that region, to be known as a omega 3 point or the omega 2 point. But this is the omega, omega 3 fatty acids are the really good cholesterol, or the good amount of the fat is required for lubrication of the whole body. Now remember, the lubrication, omega is indicating for the 206 bones are covered by this point, all the joints are covered by this point. Arthralgia, rheumatoid arthritis, or any kind of the pain and then inflammation conditions are there, that particular time you just add up the point to be known as the omega point is activated. So this is the third point. Then the fourth point to be known as a Z point. Z point is indicating, that is called as a 0 point. You just activate the point, is called as a 0 point. So 0 point is the great point, is the central point of the body, or the central point of the ear, is making the equilibrium in our body. The solar plexus are good, abdomen is good, gut is good, then the brain also good. Remember, the problem we do have, then the abdominal are the reason to cause the numerous problems. So therefore the 0 point is making the harmony, and also there is a equilibrium is taken place. Then the last point to be known as a S is indicating for the Shen men. You just add up the point called as a Shen men, but this is called as I told you, is the door of the heaven. But this is the calm and then calming down to the body system. And by the way, this is the topmost point to treat for the any kind of the pain condition. You remember, there is the person will get induced the natural sleep, the person who have the anti-inflammatory, or there is the inflammatory condition is there, or some kind of the ESR and C reactive protein, or some other inflammation in the joints, arthralgia is there. So that time, remember, inflammation, the person who is awakened all the time, or 2 hours 3 hours person is sleep, the inflammation will not come down. The person gets the natural induced sleep, so that time the inflammation will going to get repaired during the sleep as well. By the way, the Shen men also having the great property to get the good analgesic point in our body system. So therefore you just use the heaven door as well to calm down our central nervous system. These are the points called as a battlefield acupuncture. But how to do this point? You just apply the 1 point. Now the patient having the pain on the left shoulder, so we just apply the needle. You ask them to move that shoulder, or extension or the adduction, abduction to be taken place. In this way we try to rotate that particular region, that energy move on to that region. The patient feels some kind of the relief as well, number one. Number two, when the patient feel that I don't have the relief, then you just apply the thalamus point, ask him to move that region. Maybe whole body pain, or any specific area pain, or the knee pain, or the back pain, anywhere in the body having the pain, on that particular time you just apply the needle, ask them to move that region to understand what kind of the pain he do have. Then the one side you completed, the patient feel some kind of the relief, or the still he have the pain, but he will going to still lie on you. But however you wanted to use as the some other protocol, you just apply the needle on the other ear, then 10 needles or the 10 points. I believe that definitely the patient feel lot of relief related to the pain. Today he may not get relief pain, tomorrow obviously he will get the relief, or during the application itself is the pain will get the relief. You just activate the point by using the electrical stimulation. You just apply the omega 3 point. You just use the stimulation by activating this point. Yes, you just apply this point, some kind of the vibration, patient feels some kind of the sensation. But are you feeling some sensation, sir? Yes, this kind of the sensation, you just apply the cingulate gyrus, then you just apply to the thalamus, then further omega 3 point, and the fourth point is the 0 point, the fifth point is the Shen point. You just activate in this way, patient obviously, or you wanted to give us a continuously stimulation, you just apply the wire connectivity to that region, also get the maximum recovery. So hopefully you understand, these are the points which we applied to the battlefield acupuncture.